Hi everybody and welcome to the Julian House question and answer session. It's not quite as live as we hoped it would be. We had some technical difficulties, so sorry if you sat and watched us for a bit without hearing of any sound. So we're going to record it again for you, and please feel free to send us direct messages, any questions that you've got that you didn't feel were answered today. I'm Kathy Adcock, by the way. I'm the fundraising manager for Julian House, and I'm joined by my colleagues Roanne Wootten.
Hello.
And Becci Miller.
Hello.
Roanne is our operations director at Julian House, and Becci is our complex adult team leader in our outreach team. And we've just discovered actually that between the three of us, we've actually worked for the organisation for nearly 40 years. So we're not quite sure what that makes us, but it does show that we're absolutely passionate about what we do. We get asked a lot about rough sleepers, about what people should do, about how we're helping them, about what the future holds, and we just thought it would be a really good idea for you guys to put your questions forward to ask us so that we could talk to you all as a group rather than a one-on-one session. So what we will do, this session is going to be based around the work we do in Baines, but please feel free to ask us any questions about the work that we're doing in Basingstoke, in Exeter and in Dorset, because we're doing equally great work there as well. We've been sent some great questions already, so I'm going to start with those. But before I do, I thought it'd be a good idea to put what's happened in the last 2 months into some context and see really what the consequence of the coronavirus has had. Roanne, would you just give us an overview of how life was like for rough sleepers in Baines 3 months ago?
Sure. So we had Safe Sleep open across all of our areas, which is our winter shelter. So up to 20 people per night were staying in the winter shelters, and those are very communal spaces. So when the coronavirus hit, we quickly realised that actually we were not going to be able to keep those shelters open post 31st of March. We were already in exit planning stage for the people that were staying in the shelters, and we were looking at what the plans would be for their housing. But coronavirus really sped that situation up because we knew that we needed to make sure that everybody coming from those shelters had somewhere safe to stay and somewhere they could stay for the duration of the pandemic. So we closed those shelters as soon as we could, as soon as we had enough housing offers for everybody. And since then we have housed more than 40 people in Bath and North East Somerset and worked with partners across all of our delivery areas to house people into bed and breakfast, into hotels and into more sustainable accommodation through the local authority in Bath. So we've worked really hard, and we're continuing to work with partners to make sure that those people get a clear message that the accommodation, that they're not going to go back onto the streets, that the accommodation either that they're in is sustainable or that they are going to be moved into somewhere that doesn't involve them moving back out onto the streets where they've come from. So really important messaging. So it's been a really big drive to get people in, and continues to be a big drive to get people in, and it's been really successful. People have complied really well with the lockdown measures, so we're really proud.
Thank you for that update there, Roanne. So on with the questions. Becci, if you wouldn't mind, if I can put this first one to you. What additional challenges have your clients faced due to the pandemic, and how have you helped them?
There's been a huge amount of challenges that our clients have faced during the pandemic. Social isolation has been a major factor, where there's a lot less people on the streets, so there's a lot less communication with other people, and sometimes for our clients that's a really significant part of their daily interactions with others. So that dropping off has been really, really difficult. So we've tried to combat that by being more available, being around more for our clients, making sure that they've got access to things that they need, such as a phone, so that they can keep in touch with their social and support networks. Access to food has been really challenging, because whereas there was quite a lot of services previously that would offer meals and food to our clients and members of the public donating food to clients, that's sort of slowly dwindled away. So we're at a point where we would be offering clients a meal a day from Manvers Street Hostel at lunchtime. And then there's a meal delivery service for our people that are staying in our emergency accommodation. Substance misuse can be a factor for quite a lot of our clients, and that's been particularly challenging. We wanted to make sure that everybody's got the support they need in that area, particularly when drugs aren't available and all their emotions come to the fore. They're very, very vulnerable. So we've been working with Developing Health and Independence and the Specialist Drug and Alcohol Service around making sure that everyone that we're supporting has got the support that they need in that area and access to any potential medication they might need as well. And hand in hand with that really has come the mental health challenges. So people feeling alone, feeling isolated, feeling very raw where they've not been able to use the substances that they might have previously used. We're very lucky that we've got a mental health outreach worker on our team from the Avon and Wiltshire Partnership. So he's been very busy spending lots of time with clients, going out and seeing them and making sure that their mental health is okay and offering support to those individuals. And then access to services generally has been very difficult, where some services are offering a lot more telephone support, there's less face-to-face contact. So going back onto us providing those mobile phones so that clients can have that contact with their support networks, and us increasing the support that we offer and doing things from a supportive point that we wouldn't maybe normally offer as part of the service. It's been really interesting and challenging time. And then just the transition for those that have gone into the emergency accommodation, coming indoors, being in a different environment, a different atmosphere. Some clients have felt very enclosed when they're used to being outside. Some have really struggled to get used to being somewhere that's furnished and has got a bed that they can access. So having those conversations with everyone that we're supporting around how they're managing that transition and how we can support them to become more comfortable indoors rather than outdoors.
Thank you, Becci. That's not just one or two challenges there. It's really complex, isn't it? And yeah, well done on making sure all that's happened. Following on from that, Roanne, possibly one for you here. What's been the most challenging aspect of this crisis? And I guess maybe that's being asked for both our clients, but also for Julian House as an organisation.
Sure. So I think the speed at which we've needed to work at has been really challenging. So even before the government directive came out to say that all rough sleepers needed to be housed, that came out on a Thursday, that needed to be done by the weekend. So that was a challenging time frame in itself. But we'd already started that process. We already knew that people needed to come in and that it wasn't possible to live out on the streets and protect yourself from the coronavirus and the risks associated. So many of our clients have significant and underlying health conditions that it was really important that we got people in. And so the speed at which we needed to work was probably the most challenging. Just simple things like ordering enough furniture for 16 people when things had closed down. So that was a real challenge for us. But also as an organisation, we faced the same challenges as many businesses, many people working from home. We had staff whose children were no longer able to go to school. We had staff who were needed to go home and work. So moving ourselves onto online platforms and making sure that we were really as resilient as possible to many of our staff teams going home. We furloughed staff through our charity shops. Thankfully, our bike workshops are starting to come back and open up, which is amazing. But we faced all the same challenges as any other business. And as a third sector, as a charity organisation, we have really thrived in those challenges. And we've built a really good future for ourselves. So I'm really proud of what we've managed to achieve.
Thank you, Roanne. Next question for Becci. As the consequences of the lockdown develop and more people become homeless, what is in place to ensure that the most difficult to house don't drop to the bottom of the list?
I think for us, the solution there is around Housing First, which is a service that we've been offering in partnership with Curo and Developing Health and Independence for about the last 18 months. And the purpose of that service is to identify the most chaotic and difficult to house rough sleepers, and Curo offer them a tenancy. and Julian House and Developing Health and Independence offer support to maintain that tenancy. So each individual is allocated with their own key worker, and they do lots and lots of intensive work around managing a tenancy and also whatever is important to that client and whatever their goals are. So that's been really, really positive. And at the moment, Curo have been providing some temporary accommodation to some of those clients, so that we're hoping is going to ease their transition into that Housing First service so that they don't drop through the net. And there'll be lots and lots of work around supporting those individuals and building the partnerships and the relationships that we've already got with services here so that they can have successful tenancies.
Thank you, Becky. The next question, I think, is one that I will answer. The question was, there feels like there's been some real momentum in public perception. How are you trying to harness and maintain that goodwill? Yes, to whoever asked that question, you're absolutely right. We've seen an amazing wave of support for Julian House, and it's been demonstrated from donations, both financial, gifts in kind, to our offers of help, to even down to the messages that people are leaving when they make a donation on Just Giving. When we share this with the team, it's great for to uplift their spirits and see that people really appreciate what we're doing as a team. Our ask for linen and food to help prepare the new accommodation site we had an overwhelming, phenomenal response to that, and we had to stop asking for donations after 2 days because we just couldn't cope with any more. But it's just so fantastic to see the public on side. Before coronavirus, the majority of communication we had with our supporters, apart from social media, was around our fundraising events for those who are taking part. Now that those events aren't happening or have been postponed, we've gone on to virtual fundraising platforms and are communicating with a different audience slightly as well. So our virtual quizzes, the 2.6 challenge, and the fundraising events that our individual supporters and corporate supporters have done, I've just made it a bit more accessible to everyone. We've also tried to harness that goodwill by increasing our monthly e-newsletter to weekly or every other week where necessary, keeping people up to date with information about what we're doing, the progress we're making, and how their support is helping us to achieve that. And I'd recommend anyone and invite anyone to sign up to our newsletter. It can be found on every page of our website, and then you'll get those usual updates. We've also updated or uplifted our social media in terms of making sure people are aware of what's going on, for statistics and news articles, as well as messages about, for example, the bike workshop opening. And I really hope that we've kind of gained some more support and that this support will keep helping us moving forward. Because whilst we're doing amazing things, we still need funds to make those things happen. So yeah, I think hopefully we'll just harness this support and take our supporters on a better and more transparent journey. Roanne, a great question for you. What's the future of homelessness?
Eradication of homelessness. Yeah, that's a great question. I mean, the future of homelessness is housing. We absolutely have to build enough houses for everybody to make sure that everyone has their basic human right met, which is a safe home for them and their families. So it's really important that we continue to work with central government, with local government, and make sure that everybody has access to the accommodation with the support that they need at the right time and at the right level when they need it. And that's exactly what Housing First is about, that fluctuating support when people need it. So the future of homelessness is more housing, but it's also to continue on the good work that we've built throughout the pandemic. We started it pre-pandemic and throughout. Public Health England and Public Health locally have been fantastic engaging with us. We have a homeless partnership meeting every week, and they always send a representative who will give us a really fantastic perspective from Public Health, and it's been so helpful throughout the whole of the pandemic. And I really hope that partnership continues, and I'm sure it will. So I think building on the positives of what's happened over the last few months and going into the next few very uncertain months will mean that we are able to build on our good work and continue to house as many people as possible and build on the fantastic partnerships that we've continued to continue to look after. So it's positive, a positive future.
Thank you. Roanne, if I can just stick with you, these two questions actually are very similar and follow on from what you've just been saying. How do you hope to keep people off the streets once the pandemic is over? And what is going to happen to our temporarily housed clients now that the government funding for the scheme has ended?
So we've already started to exit plan with the local authorities and our other partners that we work closely with, and that means freeing up the supported housing pathway so people can go into their own accommodation through Housing First, or they can go into shared accommodation that's got support on site. So making sure that there are vacancies in all of those accommodation options is key now. So the move on is what we have to focus on, and that's what we're doing through the Homeless Partnership, and making sure that everybody has got an accommodation option at the end of the pandemic. So there's absolutely nobody in central, local government, in third sector organisations, in charities like our own, who think we should go back to how we were with people sleeping rough on the streets. There is no political will to do that. What there is will to do is to move forward and make sure that there is enough accommodation for everybody. So we're hopeful that we can bring that together and be a pivotal part of that with our partners.
Well, that sounds amazing. The next question is one that I will attempt to answer. What are the logistical challenges you need to overcome to get our charity shops reopened? Obviously, the first thing for us is making sure that everybody would be safe, our staff, volunteers, and the shoppers. We're already and currently identifying the needs for PPE equipment in all of the 6 charity shops, and looking at how we're going to be able to, make sure that social distancing is taking place. That's going to be a challenge in itself, and we may need more volunteers to help us to do that, to make sure that that's happening. Volunteers in themselves may be a challenge, as many may be self-isolating or shielding, as may our paid staff at the charity shops. So we're about to have discussions with the hub to see if there's a pool of volunteers that we may need to call on if we need to. In that situation, and stock is going to be a problem. The charity shops have been shut for a while, and whilst we know that everybody's been having a big clear out and you can't get anything anywhere, we will be starting to do some door-to-door pickups and bag drops in the next few weeks, and we can keep people updated about that. And then we'll make sure that those bags are left for the appropriate time before we start sorting them. Depending on when the shops open, then at that stage we'll be able to see what measures we need to put in place about people touching items and things like that. But yeah, we are already looking into what we can do for when the shops open, and we'll be in touch with everybody, well, in our social media, etc., when that happens. The next question is another one for me, actually. I think, can you provide a link to a list of the amounts of money that socially conscious businesses in Bath donate? I wish I could. I wish there was this list, but unfortunately it doesn't exist, so I can't link you to it. All I would say is that if there are any socially conscious businesses out there that would like to support us, please get in touch with me and we can have a chat about how you can do that. And we know there are loads out there, so it would be great to hear from you. Roanne, I like this question. The crisis has obviously had a huge effect on the lives of your service users, but what has it got you excited for about the future?
Wow. Okay. I think that we've proved we can do it. We've proved that with enough political will and dedication and commitment to ending rough sleeping, we've proved that we can make huge strides towards eradicating rough sleeping. So I think just continuing on that positive road to not tolerating rough sleeping any further in our society, and not returning to a place where we see people sleeping rough on the streets, is really, really important. So I'm excited about that for the future, and think that we will continue to work with central and local government and our partners to try and influence that future for our clients and prevent as many people becoming homeless as possible. I'm also excited for the charity sector, for the third sector, and around the changes that we've made to become more digital and to go online and to make sure that we're working in really smart ways. And it's fantastic to see people using Zoom and Teams, and long may that last, because I think it's actually brought us into a very efficient way of working. Although of course we all miss people contact and one-to-ones with each other. I think there's real potential for a legacy around some very smart working in our sector. So it's fantastic.
Thanks for that, Roanne. As long as it all works, okay, hey? Just lastly, and I just want to say to everybody, please do continue to give us comments, and we will try and answer them in turn. And I'm sorry that we can't do that live with you today. Obviously, at Julian House, we have many other projects that we're still running, our supported housing projects. How has the impact of coronavirus affected these, especially thinking about our domestic abuse projects?
Sure. I mean, it's been really challenging for people who are living in shared houses of 4, 5, 6 or more people. So in our refuges in particular, women who are trying to homeschool their children, there could be 10 or 11 other children in the house. So it's been a real challenge for them. We do provide services, refuge services for men with or without their children. And we're really expecting a influx of calls towards the end of the pandemic, when lockdown really starts to be lifted. A combination of serious mental health issues and domestic abuse, where people have felt like they haven't been able to make that change and exit that abusive relationship. They will hopefully come out and have those conversations with us. But what I would say is do so early. Don't feel like just because you are in lockdown you cannot pick up the phone. You really can. So Women's Aid have a national helpline, Mankind has a helpline. Please do get in touch. And at the moment our refuges are full, but we are working really hard. We're moving people every week out of those refuge beds into their own accommodation. So please do get in touch if you're feeling unsafe, if you're being controlled, if you have any sort of violence in your relationship. Please come forward, pick up the phone. Don't stay in an abusive relationship. So I think for our refuge, that's definitely a challenging space to be in. But also for our supported housing projects, some people had only just moved in when the coronavirus pandemic and the lockdown really started, and so they hadn't even had a chance to get to know who they were living with, and then all of a sudden everybody had to stay in. So it's been a really challenging picture for them, and there's been some serious adjustments with the support of staff that have needed to be made. But the staff have been amazing, and the residents have all reacted really, really well. We're really proud of all of our Julian House residents and how they've coped with lockdown so far. So I'm really hopeful for the future and how we can recover from this pandemic.
Thank you for that, Roanne, and thank you both for answering these questions. And I really hope it gives everybody at home the message about what we're doing and the struggles that our clients have been through, but where we're looking for the future. Just to remind any of you, please send messages to us, and we will try and answer you as and when we can. And apologies again to those of you who sat and watched us live without any sound. Really, no idea what happened there, and huge apologies. But thank you everybody for watching and listening to this, and for your support. We can't do what we're doing without that. So a big thank you to everybody. Thanks, Becci. Thanks, Roanne, and stay safe, everybody.